I appreciate the organizing committee for giving me the opportunity to present the data instead of Dr. Chester, who was not able to attend the conference. So the first set of the results that I showed you was introductory for this study. In this study was performed in Argentina by Dr. Gabriel Bo and Dr. Chestas at the National Center for Reproduction in Cordoba. So in this particular study, they tested the selective dose of 5 ml in dairy cows that are identified the ones that have the endometritis or metritis. And the data that I'm going to show you today are the data from the halfway through the study using the 500 animals, and the goal is to complete it in 1,000 cows. So again, like most of you are already familiar with, when we talk about endometritis, we think about inflammation of the uterine endometrium more than 21 days postpartum. And based on the simple classification, we can say there is a clinical endometritis defined by a purulent or mucopurulent vaginal discharge, or subclinical that is diagnosed and defined by the uterine cytology in the absence of the purulent vaginal discharge. The importance of the endometritis lies in fairly high incidence of 10 to 30 cases per 100 cows, and that leads to significant effect on fertility of the cows by increased interval from calving to first service, lower first service conception rates, increased cooling as well. Overall cost that is associated with reduced fertility can reach up to $10,000 for a herd of 250 cows. And again, then there is a high risk associated with the public health that is related to abuse and overuse of antibiotics that can lead to increased antimicrobial resistance. So there is again significant research interest to find and identify new therapies or protocols that could enable to reduce the use of antibiotics or completely replace them. So again, there is a significant amount of literature that would define the definition of the endometritis based on the cutoff numbers of the polymorphonuclears observed in the uterus and the days in milk, and they can range from 1% and 60 days in milk and all the way to the 18% for the 20 to 33 days in milk. So for our study purposes, we focused on cutoff value of 8% and using the cows that are around 21 to 33 days in milk. And particularly because the study was done in Argentina, they were more familiar with these protocols. Again, this slide is repetition from the previous one, and for those who just joined us, I'll emphasize that we were using the mycobacterial cell wall fraction that is derived from non-pathogenic Mycobacterium flea, which does not cause any TB positive reaction, but has the same antigenic properties like the regular Mycobacteria, meaning that is very good and appropriate immune modulator. Again, the mode of action is related to the strong induction of the innate and adaptive immunity, either through the influx of the neutrophils or triggering the different cascade of immune reactions leading to the production of different cytokines. And overall activation is achieved through the TLR2, NOD2, monocytes, macrophages, colony-stimulating factors, and again, overall interplay between Th1 or Th2 immune responses. In addition to what we showed in the immune stimulation, this formulation of mycobacterial cell wall fraction has been used and is being used in different calf managements to improve the neonatal calf health. We tested different doses of IV, IM, sub-Q, and right now all the results that we're getting suggest that we can control morbidity or mortality of the young calves in the absence of antibiotics, and as well as some infectious diseases such as the mycoplasma. So having all this in mind, we thought that the logical step would be to target some of the reproductive issues that are commonly seen in dairy herds. So the main objective was to evaluate the efficacy of one formulation of mycobacterial cell wall fraction on the reproductive performance with the cows that has identified with the clinical or subclinical endometritis. We believe that the high influence of the neutrophils can accelerate the clearance of the potential infection and restoring the homeostasis of the uterus, enabling the improved reproduction performance. So the study designed for the purpose of this presentation included only 500 cows. However, the objective is to enroll 1,000 cows by the end of this year and to complete the study. So we had 500 cows that were on average 21 to 35 days in milk. The vaginal discharge was visually examined and scored from 0 to 3 based on the Williams score, meaning that the 0 relates to the clear mucus, 1 clear mucus with the flakes of the white pus, and 2 more than 50% of the white pus and cream, and with 3 was scored more than 50% of the pus in the sample. So based on the vaginal discharge, cows were randomly allocated to 2 treatment groups and then further down to 2 subgroups. The first group had the cows that vaginal discharge was equal to 1 or less than 1, and they had a control group, which means that they didn't have any treatments, or received the 5 ml or 1.25 milligrams of mycobacterial cell wall fraction diluted in 55 ml. And again, this dose was chosen based on the previous result that I just showed you. And the second group included cows which had the vaginal discharge 2 and 3, and in that group we had the 2 subgroups that either received mycobacterial cell wall fraction or exceed at the dose of 6.6 mg per kg subcutaneously. So the cows were artificially then inseminated roughly 2 weeks after, which correlates around 45 days postpartum. And the reproductive parameters evaluated were days to the first service, days from treatment to first service, how many days were open, conception rate at first service, and pregnancy within 150 days. So the first set of results shows the 2 graphs, days to first service and treatment to first service. Like you can see that there was no much differences between the 2 groups that were considered as a normal with the vaginal discharge less than 1 and 1. However, we saw and observed a statistically significant difference in days to the first service between the cows that had the vaginal discharge 2 and 3 compared to the exceed, and also treatment to first service again was statistically significant between the group that received our product and exceed. And that statistical significance related to almost 7 days earlier those cows were ready for the insemination compared to the ones with exceed. So and the second slide shows the conception rates at the first service and within 150 days. So again, there is not much of the differences between the cows with vaginal discharge less than 1. However, when we look at the exceed group, again, there is a quite big numerical difference, still not statistically significant difference. But again, later on, when we look at the pregnancy at 150 days, we observed that there was a numerical difference favoring the group that received our product compared to the controls. And then even the group that received exceed was still numerically higher compared to our group, but that gap was significantly shortened, and we believe if we continue with this trend, we would be able to hopefully equal these numbers. We don't aim to be statistically better than exceed, but if we are in the same ballpark, that would give us enough confidence that we can say that the product can be considered as an alternative to the use of antibiotics in the cows with clinical endometritis. So since we collect the cytology samples before administration of the product, we did a retrospective analysis including the cytology into these results, and then we broke down the groups based on the number of polymorphonuclears, and then we had the groups of the that are considered as a normal and were not treated or received our product, group with the subclinical endometritis, which had a vaginal discharge score of 0 and higher polymorphonuclear counts, and the cows with the clinical endometritis with the vaginal discharge more than 0. This is where the results got a little bit more interested. As one can appreciate, again, there was not much differences in days to the first service between the normal cows. However, there was slight numerical difference favoring group that received the mycobacterial cell wall fraction compared to the cows with subclinical endometritis. And again, statistical significant difference for the group with the clinical endometritis receiving our product compared to the exceed. The same trend continued with the days from treatment to the first service with a slightly numerical difference favoring the MCWF group, and again, statistically significant difference compared to the exceed group and within MCWF group. This trend continued and reflected further in the conception rates at the time of the first service and pregnancy rates within 150 days, because we were able to see that the cows who received our product had numerically higher values and times compared to the subclinical endometritis, and the pregnancy rate was higher in 150 days in the cows with the subclinical endometritis that received the MCWF. And what was really interesting is to see that the gap with the cows with the clinical endometritis was even further reduced compared to the exceed, which again gives us enough confidence that if we continue with another 500 cows, that at least we will be able to achieve this maybe slightly numerical difference, but not a statistical one. So at the end, I would like to conclude that the intrauterine application of the product significantly improves the time to first service in cows with the clinical endometritis, that the MCWF treatment in lactating cows with a vaginal discharge score less than 1 and subclinical endometritis between 21 to 35 days in milk have positive effect on fertility, increasing the pregnancy rates, that MCWF can potentially be considered as an alternative to antibiotics to treat endometritis and clinical endometritis, but increased sample size is required to make that statement valid. And additional studies are underway to prove the efficacy of the product in a variety of dairy cows with metritis, endometritis, and exploring different routes of administration, because the intrauterine administration is sometimes not practical. So we're looking into subcutaneous or intravulvar administration as well. So with this, I would like to thank you, and I'd be more than happy to answer if there is any questions.